Non-English speaking population, Environmental and Cultural Factors by Christina Lacombe. Specific health concern for this population. Patients with limited English proficiency experience difficulty in communication with the providers, higher rate of medical errors, low comprehension of medical diagnosis and instructions, inappropriate diagnosis and treatments, worse health outcomes in English-speaking patients. They receive lower quality of care and less likely would have follow-ups. The result of language and cultural barriers can cause misunderstanding of patient diagnosis, treatment and self-care options, discharge instruction, misunderstanding on improper use of medication or serious medication error due to the language barrier, poor understanding of procedure or preparation for the procedure. Common media portrayals of immigrants and refugees as enemies at the gate. They usually poorly represent their culture and often focusing on the negative more than positive. They call them a resource of the infection disease and terrorists. Cultural environment and family support. Many families have experienced separation for extended periods as children are sent ahead to live with their relatives or parents emigrated first in order to establish a life before sending for their families. There is the stress of dislocation to a new environment and culture. After arrival, they face the challenge of adapting to a new culture and learning new rules and roles. They may experience conflict between generations as children and youth often acculturate more quickly than their parents. Many parents experience the stress of not being able to speak the language with adult and child role reverse when children learn English more quickly and need to act as interpreter and negotiator with the healthcare and school officials. And as a parent's experience may not be as relevant in the United States as in their country of origin, parents may feel diminished and disempowered from their roles as respective elders and experts. Finally, immigrants may also experience resentment, discrimination, and hostility in their new community. Cultural environment, roles of peers. Peers are increasingly recognized as potential powerful agents in promoting health and well-being. In ethically diverse schools and communities, adolescents are likely to interact with peers both from their own ethnic group and from other cultures. The values and attitudes expressed by their parents and their peers are likely to play a role in the formation of ethnic identity. A positive relationship of ethnic identity to a variety of psychological outcomes, including self-esteem and ego identity. Limited English proficiency is also likely to affect the quality of care immigrants receive. For instance, immigrants with limited proficiency report lower satisfaction with care and lower understanding of their medical situation. Not surprisingly, limited English proficiency also affects patient safety, increasing the probability of an adverse medication reaction resulting from the problems in understanding instruction. Providing written instruction in patient native language is not always an effective solution, given that some immigrants, particularly those who are older and have less formal education, have limited literacy in their native language as well. Adults with limited English proficiency and their children are much less likely to have an insurance and a usual source of care, have fewer physician visits, and receive less preventive care than those who only speak English. A number of federal and state regulations are designed to protect limited English proficient patients from encountering healthcare barriers. Healthcare organizations that receive federal funding must often provide language assistance service, including bilingual staff and interpreter service to no cost to each patient or consumer with limited English proficiency at all points of contact in a timely manner during all hours of operation. There are many important and practical reasons for patient and physician to communicate effectively and to understand each other. For example, physicians need to obtain accurate medical histories, and patients need to understand physician instruction and become an integral part of patient-physician partnership. More often than not, limited English proficiency patients are hampered in this effort because of language barriers. These barriers are likely to result in a fewer visits to provider and delay in preventive services, fostering acquisition and exacerbation of chronic condition and deterioration of acute symptoms, leading to hospitalization. Unresolved linguistic and cultural barriers can contribute to misunderstanding among the patient regarding diagnosis, treatment, and self-care options. Other implications of these barriers can include inappropriate use of medication, lack of informed consent for procedure, long hospital stay, poor patient satisfaction, and poor comprehension by patients of follow-up care plan. Temporary and permanent confusion, fear, and concern among the rapidly expanding limited English proficiency population are compounded by difficulties these individuals have in accessing healthcare resources and providers. More than 44.5 million immigrants resided in the United States in 2017, the historical high since census records have been kept. 1 in 7 U.S. residents is foreign-born, according to 2017 American Community Survey data. Social and economic factors are important determinants of health. The socio-economic status of Hispanic is significantly lower than that of non-Hispanic whites. This situation is reflected in most measures of socio-economic status, including personal and family income, poverty rate, educational attainment, and occupation. In spite of significant advances in the diagnosis and treatment of most chronic diseases, there is evidence that racial and ethnic minorities tend to receive lower quality of care than non-minorities, and that patients of minority ethnicity experience greater morbidity and mortality from various chronic conditions than non-minorities. Religion has the benefit of empowering the individual through the connecting him or her to a community, and it to superior force and might in turn give physiological stability. This ability to empower could be used by health psychologists in medical settings, and not only to help those who struggle with the disease or to promote a healthier lifestyle. Health disparities and gender. Women reported more health needs in terms of functional limitation, mobility, stair climbing, upper extremity difficulty, and disability than men. Women reported more arthritis, hypotension, and poor vision than did men. Men reported a high incidence of cancer, diabetes, and heart disease. No gender difference was identified for obesity, pulmonary disease, or stroke. Women also reported fewer economic resources in terms of income and wealth than men. Health status, access to health care, and health outcomes vary by geographic location. It also examines which aspects of location appears most to affect healthcare access, service, and utilization. Indicator of health, healthcare use, and healthcare resources can differ by level of urbanization. A patient should not expect to receive a lower standard of care because of her race, age, or any other relevant characteristic. Bias is defined as a negative evaluation of one group and its member relative to another. Explicit bias requires that a person is aware for his or her evaluation of a group and believes that the evaluation is accurate. Implicit is unconscious bias doesn't require an individual to be aware of their evaluation of a certain group and operates in an intentional or unconscious form. Healthcare professionals must be aware of these implicit biases as they may directly affect the care provided to a specific vulnerable population, like minority ethnic population, immigrants, the poor, low health literacy individuals, sexual minorities, children, women, the elderly, the mentally ill, the disabled, and overweight. Interesting fact: in Thailand, immigrants, who account for more than 6% of the country, so the country's 67.1 million population, are able to immediately buy and access the country's universal health care. It's the only country in the world where immigrants that illegally have the same health care right as nationals. Reference